Hello, I'm Dr. Barry Pakes, York Region's Medical Officer of Health. Since the removal of restrictions on gathering over a month ago and the rescinding of the mask mandate 3 weeks ago, we've seen significant increases in COVID transmission in the community. This increase was initially gradual, but our wastewater and that of other regions in Ontario indicates a very significant increase, similar to the Omicron peak earlier this winter. We've also seen hospitalizations increase, though not as significant as those back in January. One of the things we can all do to protect ourselves, the vulnerable, and the rest of the community, including the health system, is to continue to wear masks. Although we no longer have a mask mandate, York Region Public Health encourages masking in all indoor environments and strongly encourages masking when in crowds, confined spaces with poor ventilation, or when in close contact with others. Even if you choose not to wear a mask some of the time, please keep one with you in case it is needed. Last week, the province announced a fourth dose of the COVID vaccine recommended for individuals aged 60 and older at an interval of 5 months after their third dose. This fourth dose is available as early as 3 months since your last dose. The fourth dose is particularly important for those over age 80 or age 70 who are particularly vulnerable to severe outcomes. For everyone younger, it is still important to get your third dose, even if you had a COVID-19 infection already, as it provides longer lasting protection against severe outcomes and helps prevent reinfection. York Region clinics are already busy administering fourth doses to those eligible. At this time, fourth doses are by appointment only, but you can still walk into any York Region clinic for your first, second, or third dose. Find a clinic near you and book an appointment at york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675. Receiving a fourth dose of the COVID-19 vaccine will prevent severe outcomes should you contract the virus, including being hospitalized, getting admitted to the ICU, or worse. We know people have been asking, how many boosters will it take? The answer is we still don't know. We do know, though, that the immunity from the vaccine wanes over time, so it will depend how much COVID is circulating in the fall and whether or not there is a new variant. We know the vaccine is safe and effective. Whether this is something we'll have to have every year, like the influenza vaccine, we don't know yet. We're focusing on the now, and our goal currently is to get through to a comfortable and healthy summer and avoid serious outcomes from COVID-19 and allow the healthcare system to serve non-COVID patients as well as COVID illness. COVID is not yet endemic. We are still experiencing waves of infection as opposed to a predictable pattern. Masking and vaccination are particularly important this coming week with several holidays that many York Region residents are celebrating, including Ramadan, which has already begun, and Passover and Easter in the coming week. I strongly encourage anyone who is eligible for a fourth dose to book your appointment right away. We know how important it is to our mental and social well-being to gather with families and loved ones. With restrictions lifted, I'm certain many of you will see your families through these April holidays. But please protect yourself and close contacts by being up to date on your vaccinations. If you're feeling unwell, please reschedule your visit or attend virtually. We owe this to each other. As the pandemic is ever evolving, York Region Public Health continues to make enhancements to the interactive dashboard at york.ca/COVID-19 data. Reporting through our interactive dashboard will now occur 2 days a week on Mondays and Thursdays, effective today. The refresh time will be changing from 5 p.m. to 4 p.m. on the dashboard. This is the time of year when many people also suffer from allergy symptoms, and it can be difficult to tell the difference between a COVID-19 symptom and a common cold or allergy. Always isolate if you're feeling ill, and you can use a rapid antigen test that is available free from most grocery stores and pharmacies to test yourself if you have any new symptoms. If you're still not sure, it's best to wear a mask when around others and in public to be extra cautious. Remember, everyone is navigating this pandemic and the lifting of measures differently. Please be respectful and kind to others, whether in a public setting or for those who choose to wear a mask. Please remember to stay safe, be vigilant, and do get vaccinated.